Doc, I have pain. What should I do? I've been reading the comments to the Shim YouTube channel, and I realize many people are looking for some guidance. So instead of responding to individual questions, I'm starting a series on how I would answer the most common question, which is, Doc, I have back pain. What should I do? First of all, I'll have to let you all know that I'm talking about generalities. So individual situations may not always result in the discussed outcomes. As a doctor, I will have to answer your questions with questions of my own. After all, my first priority is to make sure I'm considering the most serious and potentially limb and life-threatening situations. If you do not have fever, unexplained weight loss, true weakness of the muscles, loss of the ability to control your bladder or bowels, or suffer from a traumatic impact or fall, then I can provide you with some general guidelines on what to do. If you have any of the mentioned situations, I would contact your own doctor immediately to make sure you don't need attention or emergency care now. I need to explain what is true weakness of the muscles. Sometimes you have so much pain that you do not want to move the muscles, but you can. That is not true weakness of the muscles. A true weakness is the inability to move the muscles despite all your efforts. This is a real problem and needs attention right away. Loss of the ability to control your bladder or bowels is even more than just a reluctance to go to the bathroom because of pain or constipation. It means you can't control your urination. You may not even feel your bladder filling up. You may start to soil your clothing with both urine and bowel movements. While it may be embarrassing, this is a type of condition that, along with back or neck pain, is an emergency and you must get an evaluation right away. If you do not have these conditions, then you can consider these general guidelines. I will list these suggestions now, but I plan on producing more detailed videos of some recommendations in the future. So here's my approach for people who do not have a life or limb-threatening episode of neck pain, back pain, or a pinched spinal nerve. What do I counsel? Well, statistically, 80% of people will have an episode of debilitating neck or back pain in their life. Most episodes improve without aggressive medical care such as injections or surgery. I counsel don't lie in bed for more than 2 days. More time at bed rest actually weakens your muscles and delays your recovery. Remain active by walking and stretching. Avoid sitting, long drives, or long plane rides. Avoid lifting objects that are greater than 25 pounds. Avoid repetitive bending at the waist. If you feel strongly about medications, consider either ibuprofen or acetaminophen. But please be careful. The medications work differently and not everyone can take one or the other. Just because you can buy these medications does not mean they're completely safe. Avoid the use of narcotic medications. They really do not help and can cause harm. Stay socially engaged. People with pain sometimes withdraw from being with others. That withdrawal can lead to depression, which can then lead to worsening pain. Alternate ice with heat for the muscles. Track your pain levels with a diary. Oftentimes you may not see improvement from day to day, but a look back a few weeks will allow you to know if you're making improvements. Sleep on your side, or if you must, sleep on your back, but make sure to place pillows beneath your knees to bend them. The vast majority of people will feel much better by 6 to 8 weeks. If you're not making improvements or you're developing any of those serious findings listed in the beginning of the video, contact your doctor right away. In my next video, I plan on discussing the difference between acetaminophen and ibuprofen and why you should avoid narcotics. Thanks for watching.